Several health departments and organizations teamed up to educate the public about tuberculosis through a health fair on World Tuberculosis Day, celebrated under the theme Unite to End TB.
Which basically calls for action from everybody, healthcare professionals, community at large, to be active, to reach out for information, for education, and also increase referral for screening and access to therapy and treatment.
Early detection and rapid and effective treatment are important when dealing with the TB bacteria. Kevin Mendes is the HIV/TB adherence counselor in the Ministry of Health. According to Mendes, the bacteria can remain dormant until it is triggered by another disease.
Tuberculosis can, in some cases, easily confused for other respiratory infections like pneumonia, simple flu. So if you're somebody that has been having a cough for 2 weeks or more, you're getting easily fatigued, you're losing weight, your appetite is decreasing, you're also having fever and night sweats. These are the normal symptoms of tuberculosis. So if you yourself or somebody has those symptoms, then you can refer them to us here at the Chest Clinic, or if you're outside of Belize City, you can go to any MCH department at the healthcare systems, the government healthcare systems, and then they can screen you for tuberculosis. It's basically a simple skin test that they do, and then that can detect the presence of the bacteria. So if you have the bacteria in your system, you can receive prophylaxis treatment, which gets rid of the bacteria.
In 2016, the Ministry of Health conducted 630 screenings for tuberculosis. 120 persons tested positive, with 66 patients currently undergoing treatment and therapy, while 88 persons were cured. The remainder, unfortunately, lost the battle.
At the start of the year, the Ministry of Health released a new TB management guidelines, which basically comes in response to what the World Health Organization has been, demanding all healthcare systems in all countries. So with the release of the new healthcare plan, we are basically increasing, the testing, the screening, the education, and this is being sensitized with healthcare providers to ensure that they're giving the optimal and comprehensive care and treatment for persons that need tuberculosis treatment. Recently, the Ministry of Health has also hired adherence counselors, which help to give the support to persons that are receiving the care and treatment with tuberculosis. So we basically do the counseling, we prepare them for treatment, work along with them through their therapy to ensure that they're overcoming those barriers that could be affecting their access to therapy. Also, we're increasing our awareness and our education campaigns. Over this last month, we have been going to different schools and different businesses, also different organizations like the Coast Guard, the Belize Defense Force, to educate them about tuberculosis and also to increase the screening of them.
Reporting for Love News, Hipólito Novello.